Hello everyone. Today we are going to see about the Paget disease of the bone. Introduction. Paget disease was described by Sir James Paget. So it is called as Paget disease in the remembrance of him. But he actually named it osteodeformans because there is deformity present in the bone which is more seen in the weight bearing bones. And it is a slow progressive replacement of compact bone by vascular spongy bone. It is due to the overactivity of osteoclasts, and it is defined as unique skeletal disorder or condition characterized by increased but disordered and structurally unsound bone in Robbins. The osteoclastic disorder is due to overactivity. The bone gets resolved very quickly, and to compensate that, there is overactivity of osteoblast cells. So there is improper formation of bone. Now coming to the clinical causes. The bones involved may be monoosteotic, meaning it involves only one bone, like it is seen in clavicle or tibia, or it could be polyosteotic form, in which more than one bone is involved, which includes vertebra, pelvis, femur, sacrum and skull. And there's a third type called facial type, in which the jaws are involved. And 70% of the Paget disease are asymptomatic, and the age usually begins in late adulthood and usually it has an incidental finding. And coming to the symptoms of Paget's disease, the disease is mostly asymptomatic, almost in 70% of patients. It is diagnosed only incidentally, and if it is present in symptoms, the symptoms could be pain. The pain is usually localized to the involved bone. The pain may be due to microfractures or boning or growth which may compress the spinal and cranial nerve roots. And there is enlargement of craniofacial skeleton. It may produce a condition known as Leontiasis osseosa, meaning it's a lion face. The cranium may become very heavy and it may become difficult to hold the head erect. And the weakened Paget bone may cause invagination of skull base, so leading to platyphasia. And regarding the leg bones, there could be bowing of weight bearing bones, as said already, so which is called as osteitis deformans. It may produce compression injuries to the spinal cord and it may result in kyphosis. So now coming to the diagnosis mainly based upon radiological evidences. And there are three phases in Paget disease, namely the initial osteolytic phase, a mixed osteoclastic and osteoblastic phase, and the final burned out quiescent osteosclerotic phase. So this X-rays shows a zone of osteoporosis. This is a lateral view of the skull and it shows zone of osteolysis. This is described as osteoporosis circumscripta. It is seen in the lysis phase of the Paget disease. So now this is an X-ray of tibia bone. So this shows a wedge-shaped area of osteolysis and diaphysis which resembles the shape of a blade of grass. So it is called as blade of grass appearance. Even in this pic we can appreciate osteolysis area. This is also seen in the lytic phase of Paget disease. Now coming on to the changes seen in the vertebra. On an X-ray, there is cortical thickening present on the vertebra on all four margins. So this resembles a photo frame appearance. So a photo frame would be thicker on the borders. So this resembles a photo frame. It is called as picture window frame appearance. So now coming on to the diagnosis based on biochemical parameters. So there is increased plasma alkaline phosphatase levels, which indicates that there is an increased activity of osteoblasts. And this is a bone specific plasma alkaline phosphatase. And even there could be increased excretion of hydroxyproline in urine, which is a sign of osteoclastic activity. And regarding the calcium and phosphates level, these are normal in Paget disease. Now coming to the complications, there could be cranial nerve compression due to platyphasia as already discussed, and which can cause sensory neural deafness. And there could be osteosclerosis in the stapes foot plate causing conductive deafness. And there could even be femoral neck fractures, which is typically vertical fractures, and risk of progressing into osteosarcoma is less than 1%. So now coming on to the treatment. The main complaint would be pain. To relieve pain, NSAIDs, steroids, painkillers can be tried, but it won't relieve the pain. The only thing which can relieve pain is calcitonin, and calcitonin is available as nasal spray or IV foam. Even radiotherapy has no effect. And bisphosphonates is a drug of choice, and there are many latest drugs like etidronate, palmitronate, clodronate, and zoledronic acid, and these are under trial. So that's it for Paget disease.